Welcome everyone to today's webinar about the SALA Healthcare Program. When we started this effort about 3 years ago, we originally went down the road of establishing a nationwide association health plan. As you may or may not know, association health plans actually cannot be formed now, and they were never really available on a nationwide basis. We continued the effort, however, and in doing so, we had three key points in bringing a healthcare solution together. One, we were looking for a national program. Two, the program had to reduce costs in a meaningful way. And then three, it had to be available to our members to provide as a ready-made membership program for their own members. In other words, something that our membership could just plug and play into their existing benefit offering. The solution itself is really an effort to simplify what's become so complex with our healthcare. There's a great choice of high-end, affordable healthcare solutions for folks to choose from, and it helps members meet the ACA regulations for preventative care. The average savings folks are seeing when compared to the statewide exchanges is about 60%. And then the last bullet there, a recent survey of our participants showed that 91% are either very or extremely satisfied with the program. So it's a very well received program. The program itself is really an alternative approach to traditional health insurance. In bringing the program together, we have two main partners. The first is Apex Management Group and the second is Sedera Health. The Apex plans really focus on preventative care, and there's two plans to choose from, the Advantage plan and the Basic plan. I'll talk about both those plans in just a few minutes. Folks then pair that plan with the plans from Sedera Health. The Sedera Health plans are cost-sharing plans that focus on the unforeseen significant type expenses that we all experience during our lives. But really, it's through Apex and Sedera together, along with a couple other partners such as Teladoc and Welldyne RX, that we get to a comprehensive, cost-effective alternative to traditional health plans. Let's talk about the program specifics. And looking at healthcare and looking at our healthcare program, there are three components. There are large costs, which we talk about in terms of needs. These are surgery, hospitalizations, diagnostic imaging, significant expenses, significant events that are expensive. Then there are small to medium costs, and these are more the run-of-the-mill type stuff, such as cold, sinus infection, flu, the things we all get throughout the year. And then there's preventative care. Let's talk first about the large costs and needs, and that's where Sedera Health comes into play. Sedera is medical cost sharing. If you're not familiar with medical cost sharing, it dates back to the 1980s and has had a foothold with religious groups and similar organizations. Sedera is not a religious group. Sedera's parent company is actually called the Caris Group, and the Caris Group is a medical bill negotiating company. And they're the company that many of the religious groups have turned to since the 1980s to help negotiate their larger bills. When medical costs really started to increase at just an unsustainable rate, the Caris Group formed Sedera. It's built upon the same industry practices and principles as a religious group, but again, Sedera is not a religious organization. And Sedera's objectives are really all of our objectives. It's compliance and credibility. It's lowering our monthly expenses and reducing our out-of-pocket costs. So depending on what folks choose in joining the program, they will certainly save money on the front end with a lower monthly contribution, but also on the back end with a lower max out-of-pocket. Let's talk briefly about medical cost sharing in general. It's big savings over health insurance. It's healthcare through community versus healthcare through insurance. As of the end of 2017, there are more than 1 million members sharing more than $1 billion annually through cost-sharing programs. It offers freedom from networks. So you do not have to operate within any given network. You can go to the hospital you choose and doctor you choose to get the care that you need. Sharing begins at your IUA, which is your initial insurable amount on a per-need basis. Simply put, that's what the member is required to pay when he or she goes through a medical event. I'll talk about that in some details in just a minute. Here's a real quick graph to show the uptick in medical cost sharing. You can see right there in 2012, when our healthcare costs really started to increase in just an unsustainable way, people started looking for an alternative. And that alternative is what we're talking about here today. Now let's talk about how Sedera works. Sedera talks about these medical events as a need. So what is a need? A need is one or more medical expense caused by a single accident or illness. So if you look at the graph on the left, this is someone who broke their leg. There were costs for the ambulance ride, the stay at the hospital, surgery at the hospital, diagnostic imaging, pain medicine, physical therapy, all of those costs, whether they occur over a month or over many months or years, but all of those costs are wrapped up into that one need. Now, the member's responsibility is that IUA, the initial insurable amount I mentioned earlier. As you can see in the middle there, our program has 5 levels to choose from. It's $500, $1,000, $1,500, $2,500, or $5,000, and that's what the member is required to pay when they have such a need. So looking at the graph there on the left with the broken leg, let's say all those expenses were $10,000. If the member had chosen the $1,000 IUA, they would be responsible for paying the first $1,000, the balance of which would be shared through the community and paid accordingly. Now, if folks sign up as an individual, they're responsible for the first 3 needs in the calendar year. If they sign up as a family, the first 5. Now, if you have a 4th as an individual or 6 or more as a family, you simply do not have to pay your IUA. They are fully shareable at that point, and there's no out-of-pocket cost for the member. Here's a real quick life medical cost sharing situation. This is a family that had a young child with a persistent ear infection. Their traditional insurance had a $5,000 deductible. After a series of antibiotics and booster injections, the family visited an ENT who inserted tubes into the child's ears. On the left, you can see the out-of-pocket cost for the family, with copays and prescriptions and the cost for the surgeon and facility. Their out-of-pocket cost was around $2,500. On the right, if the family had chosen the $500 IUA, they would of course only have to pay the $500. There are some nuances to the plan. Let's talk about membership and medications and pre-existing conditions. We'll start with medications. There are 2 types of medications we all take. Those are the curative and those are maintenance. The curative medicines are things such as antibiotics or pain meds or chemotherapy drugs. Going back to the broken leg scenario, those drugs might have included pain medicine or antibiotics after surgery, but curative medicines are medicines we take for a period of time until we're cured. There's an end date at which we stop taking those medicines. The costs for the curative medicines are wrapped up into that need and shared accordingly through SEDERA. The other type of medicines many of us take are maintenance medicines. These are things for things such as high blood pressure or cholesterol or an overactive thyroid. I take medicine for rheumatoid arthritis. These are medicines we take daily or weekly or monthly or whatever it might be and will for the foreseeable future, if not for the rest of our lives. The SALA Healthcare Program offers 3 options for people to get these medicines fulfilled. The first is the Apex plan. Probably 90-95% of the folks who sign up get their prescriptions filled through the Apex program, and I'll talk about the prescription coverage in there in just a little bit. But just as a frame of reference, that's how I get my medicine filled for my rheumatoid arthritis. Folks may also want to look at GoodRx in different scenarios or Liberty Benefits. Liberty Benefits is an add-on for $27.50 per month, and they offer great discounts, as much as 85% off. And it's something that many folks may look to if they have medicines that are just by nature quite expensive. But like I said, 90-95% of everyone who signs up gets their prescriptions filled through the Apex plan, and I'll talk about those details in just a minute. When members do sign up, they have to commit to a few things. One is to strive to live a healthy and balanced lifestyle. Obviously, making smart choices in diet and exercise can improve one's quality of life, but it also keeps everyone out of the doctor's office and out of the hospital. Now, obviously, striving to live a healthy and balanced lifestyle is not legally binding, but it is something members do have to commit to do. Members also have to commit to not use illegal narcotics and not to operate a vehicle while intoxicated. What does that mean? That means if you're driving a vehicle while intoxicated and you get into an accident and say you have medical bills as a result of that, those bills cannot be shared with the community. The principle here is that the community should not have to pay for someone's illegal activity. Also, tobacco users are certainly welcome to join. Everyone is. There is a $75 surcharge per month for tobacco users who sign up. Also, for tobacco users over the age of 50, there's a $25,000 per need sharing limit on the top 4 diseases associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. This next slide is perhaps the most important. It was for me when we started looking into this a couple years ago, and for me when I signed up about a year ago, and that's pre-existing conditions. If you have any of the top 4 listed there, high blood pressure, high cholesterol, sleep apnea, or non-insulin dependent diabetes, and assuming they're well controlled with medicine, there are no sharing restrictions. They're basically a non-event in signing up. If you have anything else is defined as anything that you've received medical treatment for or have had symptoms of in the last 36 months, there are sharing restrictions. So what does that mean? Well, let me use myself as an example with my rheumatoid arthritis. Obviously, when I go to my rheumatologist, that's covered. Getting my prescriptions filled, that's covered as well. This is talking about if a need should arise as a result of my rheumatoid arthritis. So let's say in year 1, I needed surgery. I would not be able to share the cost of that surgery. Year 2, I can share up to $15,000. Year 3, up to $30,000. After that, it's fully shareable. So for me, with my condition, it's a chronic condition. It's something I'll have for the rest of my life. Signing up was not an issue. For folks that are, say, currently pregnant, or say you have an active cancer, now would not be the time to sign up because it would obviously create a financial burden for you and your family. What we generally tell folks is that the SALA Healthcare Program is a great option for about 80% of the U.S. population, if not more, including many of us that do have pre-existing conditions. But for those that do have certain pre-existing conditions, this may not be the best option for them right now. But those are the large costs. Again, those are the unexpected costs due to a surgery or hospitalization related to an illness or a cancer diagnosis or just an ER visit. I'm going to switch gears now and talk about small to medium costs and talk about how those are handled. Included with everyone's membership is a subscription to Teladoc. Teladoc is the largest provider of telemedicine in the U.S. If you're not familiar with telemedicine, it's exactly what it sounds like. You connect with a doctor virtually over the phone or through your computer. If you need, say, just a simple Z-Pack or a simple prescription, that doctor can send that prescription to your local pharmacy and you pick it up. So it's a great money saver and a time saver. There's no additional out-of-pocket money for the member. And of course, it's a time saver because you can connect with the doctor from your phone at home or in your car or at work or through your computer. So it avoids us all having to go to the urgent care or make an appointment with our primary care physician for just a simple prescription. Also included is Second MD. Second MD is a great way for anyone to get a second opinion on anything they're going through medically, of course. And it's from some of the nation's top doctors that practice at places such as the Mayo Clinic and Johns Hopkins. Also, when you get that second opinion, Sedera will take $250 off your IUA. So going back to the broken leg scenario, if you need to get a second opinion there, for example, and you had the $500 IUA, that would be reduced down to $250. Now, getting that second opinion is not binding. The principle here is that there was a study a few years back that showed the average doctor is 13 years behind on his or her continuing education. Second MD is just a great way to make sure all of us have the most recent and up-to-date medical information available for whatever we're going through. But that's the Sedera side and the Teladoc side, if you will, of the program. I'm going to switch gears now and talk about the Apex side. The Apex side offers coverage for small to medium costs, but also preventative care, and that's the real focus here. If you recall when I started, when you first sign up, you first choose the Apex plan that best fits you and your family, and then the Sedera plan. Well, the Apex plan has two options to choose from. The option one here is the basic MEC plan. That's minimal essential coverage. As you'll see on the top there, it's 100% coverage for all preventative care needs. These are the needs defined by the Affordable Care Act, which is why the program meets the preventative care requirements of the Affordable Care Act. And it's everything from childhood immunizations to your annual physical to colonoscopies and mammograms. This option then provides a framework for a health savings account because everything else the member is going to be paying for here would be paying for out of pocket. But with the health savings account, you would do so with tax-free dollars. As you probably know, a health savings account allows you to put away tax-free dollars in 2019, as much as $3,500 for an individual and $7,000 for a family. And those funds can be used for expenses related to dental, vision, prescription, doctor visits, and also to pay your Sedera IUA. Generally speaking, about 20-25% of the folks who sign up choose this first option, and they are folks that are in good health. They're not on any prescriptions. They go to the doctor annually for their physical, if at all. And this is a great way for them to get the preventive care they need at a low price, and also set up a health savings account and put away dollars to be used down the road for if and when they do have a medical event. The second option, however, is what the rest of us choose, myself included, and that's the Advantage plan. The Advantage plan also covers all preventative care items, 100%, just like the basic plan. This program then has a co-payment structure for your ongoing medical care. So if you go see your primary care physician outside of preventative care, it's a $20 copay. If you go see a specialist, such as myself, and I see my rheumatologist, it's a $50 copay. Getting a lab work done, for example, is a $50 copay as well. And this program then has prescription drug coverage, which is the other reason I'm on this program. I do have to see a rheumatologist every quarter, and then I do take prescription drugs, which is the maintenance type medicines that we talked about earlier. Here they have Tier 1 and 2 generic and Tier 3 preferred brand name. Those higher tier drugs are usually curative in nature, meaning they would be funded through the cost sharing with Sedera. But for the maintenance type medicines, the majority of them are in the Tier 1, 2, and 3. My medicine, for example, is a Tier 2, and it costs me $27 per month. Now, when we talked about the SADERA program, I made note that SADERA did not have a network to operate within. You can go to any doctor you like, any specialist you like. On the Apex side, for your preventative care and for any ongoing care, such as myself again with my rheumatologist, you do have to operate within the multi-plan network. The multi-plan network is one of the largest networks in the U.S. There's nearly 1 million participating providers in the network. All of my doctors are in there, for example. If folks have questions about who is covered in network, they can certainly go to this website and look. But you can also just contact us. We regularly run a list of doctors by zip code for folks, so they have a great reference document as well for if and when they need a doctor or a specialist. Now let's talk pricing. The pricing you see here is for the Apex plans. And just to preface the pricing is the same for all of us, regardless of your sex and regardless of where you live. We're all paying the same amount. On the Apex plans, you'll see on the left, it's member only, or member and spouse, member and just the kids, or member and the entire family, spouse and children. That second column there is for the basic MEC plan that has the health savings account option. You see it starts at $71.40 and goes to $102 per month. That third column is the Advantage plan that has the co-payment structure for ongoing medical care and also the prescription drug plan. And you'll see the pricing is a bit more, and the arrow there is the plan I am on for $144.59 per month. Folks then pair that with a SADERA plan that best fits them and their family. For space reasons, we only have 2 of them listed here, but as a reminder, the IUAs can be $500, $1,000, $1,500, $2,500, or $5,000. We have the $1,000 and $1,500 listed here, of course. On the left, MO is member only, MS is member and spouse, MC is member and just the children, and MF is member and the entire family, spouse, and children. Going across the top, it's banded by age, those in their 20s, 30s, 40s, 50s, and 60s. And under the $1,500 IUA, you can see the arrow next to the plan I'm on for $175.51 per month. So here's my cost. It's $320 per month, and I have the $1,500 IUA. So if at some point when I am hospitalized for any sort of an event, my out-of-pocket would be $1,500. And again, that is capped at 3 such events in a calendar year. So if you look at it in terms of your max out-of-pocket, for me on my plan, it's $4,500. So for myself, it saved me about 50% on the front end. I'm based in Maryland, right outside DC. And then on the back end, instead of having a $6,000 deductible, I now have a $1,500 IUA. So for me, it's a great program. It cut my monthly in half and significantly reduced my max out of pocket, if you will, as well. On our website, if you've not been there already, are all the details on the program, including current rate sheets, details on the SADERA plans, details on the Apex plans. So there's a great FAQ on telemedicine, if you're not familiar with it, as well as 2nd.MD and the multi-plan provider search. Quick summary of the offering. It's available in 48 states right now. It's currently not available in Vermont and South Dakota. The program itself does not need an employer sponsor, so individual employees can join. They can be full-time, part-time, or seasonal workers, hourly or salaried staff, and the cost can be paid by the employee or the employer. The one caveat there is they do need to be a member of your association. But it can be structured as such where if you have a member who is a business and they're able to pay for their members' health or their employees' health care, they would pay for it just as they've always had, and maybe offset it with a payroll deduction. If you have a member who's not able to, add this as a benefit for the employees, but they are a member of your organization, they can simply offer it to the employees, and the employees can pay for it individually. So it's a very flexible plan. Also, we have rolling enrollment. Folks can enroll at any time during the year. Our cutoff is the 19th of every month. So if folks enroll by the 19th, their coverage starts the 1st of the following month. If they enroll between the 20th and 19th of the next month, then they would obviously follow the 1st of that month. Folks can also leave at any time during the year. There's not a commitment here, so it's available for seasonal workers. Also, some folks have used it as a bridge between jobs. It's a terrific benefit for your members to add, really at no cost to the company. And as we said, the average savings folks are seeing is right around 60%. It really varies quite a bit for where you live. If you're in an area like I am, right outside DC, I was paying less than other people are because we have more options. If you're in more rural areas, you're already paying more. We've had some people who are saving upwards of 200% compared to what they were paying. But like I said, the average is right around 60%. Also, a quick note here, at the end of this quarter and into the 4th quarter of 2019, we're going to be adding some discounted Transamerica products, including life, disability, and cancer type coverages through through Transamerica. Also a dental option that uses the Aetna network, and then vision coverage through VSP as well. So the goal here is that eventually folks will be able to go to your association or your chamber of commerce or your professional society and have an option for all the healthcare needs that they and their families might have, and it's all significantly discounted. Now, there's two great ways for your organization to participate in the program. The first is the select option, and the second is the access option. I'll focus on the access option because that's what 95% of the folks who sign up, if not more, have chosen. The access option is a great option for smaller groups, groups that have a small staff, because our staff will handle most of the administrative work. So with the access option, if one of your members has a question on the plan, they would contact us and our staff. If they have a question on their enrollment, or maybe they need to make a change to the way they pay for it, or maybe they need to add a dependent and drop a dependent, anything of that nature, our staff and our call center would handle that work for you. We've contracted with a call center so folks can call them 24 hours a day, 365 days a year. The Access program is a great way for you to add this program with minimal effort. Your requirements would be to set up a landing page on your website. We would then work with you and your staff to record a webinar to be also posted on the website, and then also to hold a couple of live webinars where your members can really ask some great questions. We found that the webinars, recorded and live, have been the best way for folks to fully understand the program and how it works. Benefits for your organization. Obviously, grow membership by offering a much needed benefit. Increase member retention with increased engagement. What that means is when renewals come around, for those who are on the healthcare program, it should be an easy renewal, because in order to stay in the healthcare program, they have to be a member, and a member in good standing of your organization. We must have them be a member of your organization. It's the way our plan documents have written. So it's also a great way to drive new membership as well. We've had some members have their best months ever in terms of new members adding. So it's just a great program all around. Also, obviously, help member lower their healthcare costs. It's been the topic of discussion for many of us for the last 7 or 8 years now. Generate non-dues income for your organization. There is a referral fee, a commission, if you will, that comes back to your organization for every person who enrolls. And then the last caveat there is, just like we need your members to be a member of your organization, we also need for you to be a member of our organization. Most of our members are able to join at $200 per year, and by your organization joining us for $200 per year, all of your members can participate in the program. So it's just one monthly amount, or one annual amount, pardon me, of $200 per year, and that allows all of your members to participate in the program. If you have any questions, please feel free to reach out to us. Your two main points of contact are myself and Rich Lawson. Also, of course, there's a general inquiry box that goes into the pool. That's healthcare@smallassociations.org. And again, our website is www.smallassociations.org. If you have any questions, please feel free to reach out to us. Thank you.